In this segment, we're going to treat a bilateral sacral extension using a respiratory assist muscle energy technique. And clinically, the patient may present, again, with pain across the lumbosacral and sacral region. And on the standing and seated flexion test, they may appear to be negative when in reality they're bilaterally positive. So passive SI joint motion would be restricted on both sides. When we do our landmark palpation of the sacral sulci, they palpate posteriorly bilaterally, and we come down to the ILAs, and they palpate more anteriorly bilaterally. The lumbosacral spring test would be very rigid due to the extension of the sacrum. So we're going to contact. We could use our fingers and reinforce our fingers. We could use the heel of our hand and reinforce the heel of the hand. And as in the other sacral techniques, we're going to use respiratory assist in this case. So I'm going to find the sacral sulci bilaterally. I can reinforce that with my hand, or I can just put my heel of my hand over those sacral sulci and try to have the patient prop up into the Sphinx position to help engage the motion of the sacrum to go into flexion. We would loose pack both SI joints to allow the sacrum to move more freely between the ilia. Contact with the heel of our hand, or as I said earlier, with our fingers. Have that patient take a deep breath in, as slow and we're going to resist the sacral extension or counternutation during inhalation, but then during exhalation, we're going to engage and follow or exaggerate that sacral flexion, and then maintain that. And then as the patient inhales, we're going to resist. And when they exhale, we're going to add a little more force on those sacral sulci to help improve the motion of the sacrum. We repeat this for 5 to 7 respiratory cycles, and then reassess our landmarks, reassess our sacral motion, sacroiliac motion, and then reassess the seated flexion test. So a bilateral extended sacrum using muscle energy respiratory assist.